After China and Japan, Korea is the third biggest country in Asia, one of the biggest tourist destinations in the world, and home to K-pop. Underneath the glitz of the entertainment industry and the tourism lies the truth behind the culture and society's treatment of women. I am also a 23-year-old woman. How terrible to live in fear just for being female. I survived by luck. That could have been me. These were notes left by women in response to the May 2016 stabbing of a 23-year-old woman by a 34-year-old man in the middle of Gangnam, a crowded, prosperous neighborhood of Seoul. This man had lurked in a public bathroom outside a noraebang, a Korean karaoke parlor, waiting for a woman, any woman to enter. When he was arrested for the crime, he reportedly told the police, "Women have always ignored me." Several years later, after feminist movements had started and the fight for equal rights ignited, it was revealed in 2019 that some of South Korea's biggest male K-pop stars had drugged and raped women and shared videos of the acts, which highlight how women are victimized in corporate, social, and familial life. Though women's rights movements persist and arguments for justice have been made, why has South Korea continued to stigmatize women's sexual health and encourage gender roles? To understand society's current stance on women's rights and women's sexual and reproductive health, we need to look at South Korea's history, governmental policies, and social stigmas. Until the 1980s, sexuality in South Korea was an issue that was seldom studied. The philosophical and cultural system in South Korea, that continues to be dominated by males even today, has left women following fixed gender norms at home, institutionalized discrimination and sexual harassment at work, and spy cam technology that compromises their safety and privacy. More recently, however, there has been a growing trend as South Koreans become less conservative when it comes to sex and challenge the strict gender roles that previously existed in relationships. Despite these efforts and the fact that South Korea holds one of the most advanced medical systems in the world, sexually transmitted diseases such as HIV and AIDS remain heavily stigmatized and neglected while the rate of unwanted pregnancies is high. So what can we do to encourage female empowerment, increase women's access to sexual and reproductive health, and decrease social stigmas? The answer is in our habits and our attitudes. On average, it takes more than 2 months before a new behavior becomes automatic, 66 days to be exact. More importantly, we need to challenge the gender roles in individuals' corporate, social, and familial lives and push the government to educate the youth. In doing so, habits and attitudes regarding sex and gender will change and create a more open environment. Sex education programs are the most critical interventions that would reduce social stigmas around sex and provide adolescents with the information needed to make health choices.